MedBix Webcast is a new kind of healthcare media channel to break the silo mentality and foster interdisciplinary thinking. Our mission is to fill that gap and to create a curiosity through different lenses, tapping the passion that guided the historical figures in medicine and bringing present-day groundbreaking research to the front lines. We interview physicians and leaders in the industry about present-day healthcare challenges on our live programming. Hey, welcome to the MedBix Webcast. This is Ramana Annamraju. I'm the host. Today we have an excellent program and we have a great guest. The guest is so she's going to talk about wound care management. Wound care is, maybe my accent is bad. Just to make sure that I follow my text a little bit. Wound care is one of the things very important. The world is trying to understand more and more the cost associated with it and the fatalities, the death involved with it because of the ulcers. Diabetes can cause ulcer wounds. All those things are creating a lot of problems. So wound care management is a very critical one of the important things in the healthcare industry. I interviewed a couple of doctors on wound care management. So infectious disease doctors, but now I wanted to listen to the prospect of the side of the nurses, because they're the ones who do all the dressing and everything. They understand is healing or not. They have a much more better understanding of the wounds that the patient's coming with. So either it is a diabetic wound or it is any caused injury wound, they all need to be healed. There is a lot of advances coming up. I was surprised around what are the advances that are happening in the wound care management. So we will ask our guest, Victorina Fischenich. She is joining from Justisburg, Texas. We want to know where is this small town Justisburg is. We have no idea what it is. But after that, I'm going to present a program on a dress, hidden dress. That what is the medicine behind the hidden dress? I hope that is not she's not wearing that. I promise you. So this is the story behind the hidden dress of a medicine coming out of the story about the dress, and a lot of advances, in very strange advances. You will be surprised to know. So Victorina Fischenich is joining from Justisburg, Texas. And let me welcome her. And then she is a nurse. She's a pediatric nurse. She said, let me ask her a little bit more her background. So let me bring her. Welcome, Victorina, Vicky or Vic.
Hello.
Welcome here.
Thank you. Thanks for having me again.
Tell me about your background a little bit, and just run down your background, your personal and professional background both.
Okay. Well, kind of been in the medical field for a very long time since I was 18. I actually started off as an X-ray tech, CT, special procedures, nuclear medicine, CT, MRI, and then went to nursing school and got my RN, and then went to my master's and did a geriatric nurse practitioner, and so did my wound care training with Dr. Randall Walcott in Lubbock, Texas. Justisburg is just a very small lake community, about an hour south of Lubbock. So it's not really a town; it's just a lake community. So
It's interesting. So, so it is a Lubbock is the middle of the Texas, right? People don't even know where the Lubbock is. A lot of people.
it's kind of at the lower end of the Panhandle, so not
Mhm.
really central. More central would be like the Austin area. So we're further north and west.
Vicky, we don't even know what is a wound care management is. So, can you educate us a little bit, non-physicians, and also what are the physicians that would be interested in it? Can you give us a little bit description about the wound care management? What are the things available in the wound care? What are the advances happening? So, let us talk about one by one simple steps. What are the wound care management right now? What are the things going on in the wound care?
Well, I mean, there's a lot going on with wound care right
First of
now.
all, let me ask you before, sorry
From
to interrupt you.
Go
What are
ahead.
the wounds coming from? Where is the wounds, or is it
Oh.
let us talk about that a little bit.
Well, the wounds are coming from diabetic patients. Many of I know diabetes is a big burden, but sometimes I think venous leg ulcers tend to be even a larger problem, and that has to do with lymph damage or veins. Your veins, they they have either back pressure, or sometimes these patients will have multiple comorbidities with hypertension, CHF, and they kind of just struggle with the blood return flow back. And so venous leg ulcers can be, I mean, diabetic, of course we all know it's a huge problem, but be able to use venous leg ulcers are also very large, time consuming, and they just prolong for such a long time, and I think that's what makes it challenging for a lot of providers.
So, what are the kind of treatments available? What kind of a mechanisms you have? What things you have in your arsenal to treat the wounds? Uh, so, let us talk about these, the external, all what kind of treatments you do for
Mhm.
the
I
wounds.
mean, well, there is large variety of wound care treatments out there, and since wound care isn't a recognized specialty, I mean, it would be nice if it would be, but it's not. As you are an internal medicine or you an infectious disease, that's a specialty. There really isn't a category to being a wound care specialist. So wound care has kind of evolved, and a lot of the things that have happened for wound care have been pushed along with the help of the Alliance of Wound Stakeholders. It's a organization, a nonprofit that kind of speaks on behalf of the wound community and the wound companies and manufacturers. So the products, I mean, there's a lot of products out there. There's a lot of interesting products. I kind of tend to like to see products that are a little bit more natural, or part of the of a more I guess a cost savings antimicrobial and wound care combination. So there's some products out there that are have that combination, and I like, there's copper. That's one type of antimicrobial dressing out there. There's some with silver, and there's different types of silver. There's a specific nano crystal silver that has the more effective, the longer kill. And there's a couple of dressings out there with that technology. So not, I can't say that all silver dressings are all the same. So there's some differences, and it's just knowing what's the silver that you're currently using, purchasing. So I think sometimes as providers, we need to ask ourselves more questions like, why am I choosing this, and what's the science behind it, for choosing these particular products. uh, Copper has been actually used for so many years. I mean, it goes back to, 400 BC, where
Oh my
they were
God.
using it to treat wounds, eye infections, water, you know, different types of skin conditions. They would actually sprinkle the copper in there. And, there's those kind of natural in copper versus silver. I think copper it's a natural trace element in our body that's necessary for some of these growth factors to occur, and fibroblasts and keratinocytes to angiogenesis to take place. So chronic wounds, and there's been a few papers out there, and I can't exactly quote them, but some chronic wounds kind of tend to lack that copper in them. So I've seen a few cases with some copper dressings that I thought were rather impressive. And it reminded me of going back to, this will date me, but when we had Panafil. Panafil was a topical ointment that had copper, and it also had this papaya, or a papaya urea type thing that caused allergic reactions, and it was pulled off the market because it caused some deaths. But the copper in it is that what I kind of go back to when I look at these copper dressings now, and I'm like, well, that's that robust vascular wound bed that we used to see with Panafil. But it had a lot of copper in it. So I'm thinking, there was obviously a good product, a good component, or of the Panafil, and they probably should have just pulled out the the papaya and just kept on with just the copper, but they didn't. And there's other natural things besides these metals, but I think if we incorporated some of these into wound care, maybe our antibiotic stewardship. I'm not saying the antibiotics are definitely necessary. I mean, there will be wounds that need a systemic or an oral, but maybe we wouldn't be starting off with them right away. We would try to address some of the smaller infections with a topical. Hypochlorous is another product on the market, and there's a lot of great hypochlorous on the market right now. And hypochlorous is, it's natural to our bodies. Our white blood cells create this. It has this reactive oxygen species and kills bacteria, viral, and everything. So back in 1834, when they first kind of discovered it, uh, they saw it, they didn't know what it was, but they saw that it fought infection. The problem with hypochlorous, and why it didn't, take off sooner, was trying to get it stable. So hypochlorous, HOCl, it's a really unstable molecule outside of the body. So it's in our body and it works great. But creating it and having something that can be, shelf stable and used has been a challenge. And there's a couple of companies that have made headways with that hypochlorous. Some have to be protected from light, some have to be put into glass to keep stable. Some products have buffering systems, and then there's some products that have a very short life. Like once you open it, they're only good for either 14 days or 28 days. And there's things about hypochlorous that people should know, because sometimes when you go and you see, well, wow, there's like 5 or 8 types of hypochlorous, what should I select? I think some of the questions we should ask ourselves is the parts per million. That's a dosage of hypochlorous that's important to know, because we all know from independent studies that anything over 220 parts per million can kill keratinocytes and fibroblasts. And the pH also needs to be near neutral, between 5 to 6. That's where it's most effective. You want to avoid a hypochlorous that gets too far to 10 and above. And sometimes you'll know, your patient might say it's a burning sensation, or even a hypochlorous that gets too low. So
So
parts
if
per
it is a,
million.
because of the pH value, so they get
Mhm.
a burning sensation if you don't
It
manage the
can be,
pH
yes,
value.
yes, it can. And so that's the thing with certain products is, as a provider in wound care, I think you need to educate yourself as, why am I selecting this? And is this the best option for your practice? You may be in the emergency room where you just see everybody very acutely and you see them for, a day or till they get admitted. So you may think that a Dakin's at a very high parts per million, or something very cytotoxic like betadine or chlorhexidine gluconate that is, pretty cytotoxic, is might be a good option in an acute wound. But if you're a wound care provider and you're really seeing a majority of long-term chronic wounds, for weeks and weeks, you really need to start thinking about, is this product the best product for me? Is because the parts per million are way over 220. So selecting that. And then all hypochlorous on the market is active when it is wet. So only wet. So I mean, every hypochlorous, I don't care what parts per million or whatever, it's only active. And then, the
That is a
reason.
people, physicians mistaken. Probably they don't oversee that, overseeing that is a dry product. It becomes a dry. They think it's still effective, may not be effective, right?
Yeah, it's not effective. So there's, I think there's like maybe one company out there or that has developed a hypochlorous in a hydrogel form that has been really effective. I've had a few conversations with a few people that have used it, and the Mayo uses it quite a bit for a lot of their colorectal surgeries, and they're highly infected wounds. And so they found that to be very helpful. There's lots of other systems like Cox Health that is using it very effectively system wide. So, but selecting the right hypochlorous is important to know. I mean, there's great options out there, but
I wanted to ask you. I want to
know
ask
what
you.
to ask. Yeah.
Yeah, very good. Hyperchloric acid is very
Yeah.
powerfully say.
Shelf life.
What is the general? What is the most the physicians use in general for common wounds? Is it silver patches, or
Well, it varies. You will find some sites that are very heavy into certain products. How they make that decision is probably based a little on cost. Okay, so at the end of
silver
the
is
day,
expensive, right? Silver is
yeah,
expensive.
you have to. Sometimes you have to decide, what's cost effective, and I'm not sure that all the silver products out there that people are paying for, all necessarily are really that effective. But once again, I think sometimes it would be great if there was some way that you could do a great research comparison of all the silvers on the product on the market, and see what's best. And what's, I know that the best is the ones with the nano crystals, the nano particle
Crystal.
crystals. That's the most effective silver. And the copper company tested it against their copper and had equal effective kill. And I thought that was rather impressive that they ran it against one of those.
You did work with the boron. Boron is also effective in
Mhm.
wound treatments,
Boron
right?
was is also effective. It's not it's another type of option out there. Not too many people are making products with boron, and so it's easily or widely accepted. I don't know. I think it takes a matter of educating yourself, and but knowing certain things about each product that you select. Asking the right questions. I think this is where sometimes people just kind of get caught into, okay, this is what's been given to me to use. This is what's on my formulary. It would be nice if some of the providers, sometimes the providers aren't given, the full decision to what they should use, what they'd like to use, put it that way.
So there is a, like a four kind of a, if you broadly classify, a copper, boron, silver, and hydrochloric acid.
Yeah,
These are the basically, so the people vary from each other. It depends on the patient, depends
yeah,
on the reimbursement insurance company. So they need to administer all these
yeah.
areas they need to worry about, right?
But
So it's
yes,
not
there is. I mean, you also have polyhexylene by Guatemala, that PHMB. That's another very old antimicrobial that came out in the mid 50s. And it just happened to come out at the same time that antibiotics launched it. So we all kind of switched over to antibiotics, and that one kind of got left behind. But it's made a small climb back in certain products that has been effective. There's talk that PHMB is carcinogenic. I don't know. I know that the Europeans have kind of either moved away from that, and also from silver, feeling like there really isn't some solid data. But here in the United States, I mean, the burn units, I mean, that silver is their go-to product for the
really.
majority of their wounds. Silvadene, and is that still the best option? I don't know. I mean, I personally don't know if Silvadene by the buckets is the best option.
Yeah.
And each practice or each specialty, sometimes I see these things that have been taught to them. And sometimes you'll see a lot of plastic surgeons come out of school, and they have really learned to sit the older people with wet to dry dressings, which really isn't something, but that's what you started off with. I see a lot of Mohs surgeons that use a lot of petroleum as their go-to wound topical.
What about
It's
honey? Honey, you mentioned
Yeah,
honey.
honey's another great antimicrobial that I think it's got a lot of place for it. There's some dressings out there with honey, manuka honey, and some collagen that I think are need to be looked at a little bit more, because I think they've got a lot of great potential. So a lot of great products out there. It's just, hopefully, everybody's able to kind of ask the right questions, because sometimes you get a new product on the market and you don't know enough about nanoparticle crystals and silver to distinguish between, well, why is it different from this type of silver dressing versus that. And I think that's where it would be real helpful as a provider to know your stuff, know your
These
questions.
dressing, the main function of these dressings are basically creating oxygen and the negative pressure, or more than that, anything else.
Well, I mean, every dressing on the market has a certain purpose. So you'll have some dressings that are made for, certain level of exudate. So you'll have some that are for dry wounds, and those will be a different type of category. You'll have moderate, and then you'll have those heavy exudating wounds that all need a different types. Of course, you do have negative pressure, which is proven great, well used. There's negative pressure now that you can combine with hypochlorous, and that combination of negative pressure with hypochlorous has been really successful in trying to reduce infections. But I think implementing some preventative things with hypochlorous during surgery would be high. Like if you're having a knee implant or a breast implant or a joint or a hip implant, start looking at things that you can put in your incision before closure, like a hypochlorous, to reduce that risk of having a post recovery infection, because that's where it gets really expensive for hospitals. Is to treat surgical site infections are really costly.
So these
And
dressings are, you can be used for
yes,
prevention
yeah,
also during the surgery and all
yeah.
those things. That's
And they use dressings like the silver dressings after every knee implant, every hip implant, to kind of protect their incision from infection. So that's another thing that hospitals are trying to do, to prevent these infections. But I think before you close, you really need to start looking with patients that are high risk, multiple comorbidities, elderly, diabetic, and that they're getting a hip surgery. The risk of failure kind of increases. So anything you can do before you close that surgical site, and then to protect your incision site from any infection is important.
Because surgeons may know a little bit more about the wound dressing and all the dressings and then complications. But primary care, what do you think of the primary care knowledge about this wound care? That's a, that is a challenging, right?
Well, yeah, I mean, I think primary care, there's a lot of, and it always depends on the patient. So there may be patients that are diabetic that maybe don't go to their diabetic physician, the rheumatologist, or they choose to go to the podiatrist, which the podiatrists are doing a lot of great wound care.
Oh,
I do
really?
see a
Okay.
lot of podiatrists that majority of those podiatrists will end up doing their own dressings as well. In practice, I just see that often, not just having the nurse do them, but they tend to be the ones doing their own dressings as well. But podiatrists, surgically trained podiatrists, see them. If you're going to a primary care physician for wound care, and it's usually sometimes the first time, and depending on the comfort level of the physician,
Right.
sometimes he'll refer it out to a wound care provider.
Yes.
He may have those contacts or friends in his industry that he refers to often. But there is sometimes that primary care doctors will try to treat and manage the wound for the patient. So it is you'll find in wound care now, a lot of the outpatient wound care physicians are really from a large background. You'll have family doctors being wound care, you'll have OBGYN being wound care, you'll have
Yeah.
maybe retired emergency rooms or retired plastic surgeons kind of taking on that role
Right.
for wound care. So,
Interesting. So, let me ask you reimbursements a little bit. Is a very evolving, right? Wound care was not a highly reimbursable before. Now they're paying more attention to reimbursement on the wound care side because it could prevent a lot of death and other things, right? Preventing hospital admissions. Is that, do you agree with that?
uh, well, yeah, the wound care reimbursement is always shifting, and currently there's advanced wound care products right now, cellular tissue products and synthetics that are going through where we're going to go through some changes. But the board that I told you about, the Alliance of Wound Care Stakeholders, Marcia Newsgard and her team, have really been the forefront of trying to help manage those costs, because sometimes CMS will try to do away or not pay for something, or a good example is the cast, the offloading for a cast for a boot. So if you have a diabetic foot ulcer, a total contact cast, you need to will properly offload. That is the golden standard. But CMS wasn't paying for it. So along with the help of the alliance and a lot of providers that they gather together, the membership is wound care stakeholders. It could be providers, it can be hospital systems, it can be manufacturers and distributors. If more of the wound care, uh, I guess, stakeholders, every manufacturer joined the Alliance of Wound Care Stakeholders, I think we'd be able to really manage what CMS does in a more
More cohesive way,
group
more
effort. Yeah, a
coordinated
group
effect. Yeah.
effort. And really the alliance is pushed for doing they're trying to make sure that CMS doesn't cut off certain things that may put a certain
Pressure, yeah,
minority or
pressure,
rural
yeah.
area from not getting these
It's
services.
it's called Alliance Wound Care. Alliance
Alliance of Wound Care
Alliance Wound
Stakeholders.
Care. Yeah. So they
that
are
group,
stakeholders. So the all kind of
yeah, yeah,
stakeholders join the
yeah,
in their group together to
yeah.
support all the systems in the wound
Hmm.
care system. Oh yeah, very good. Excellent. You gave a great education. Let me present my topic and then a little bit connected with your background too. MRI, CT scan you're talking about. I'm going to
Yeah.
present that and come back and ask you. When I come back and ask you, you're going to watch together with me. You can jump in any time.
Okay.
Then after come back after my presentation, I will ask you about your contact information. People can reach you, and then what is your next steps in your career. That's what I'm going to
Okay.
ask you. Okay.
All right.
So let
Sounds good.
me let
All
me
right.
bring this together, and we're going to watch together. I'm going to bring both of us in the bottom. Okay, that's it. So this is the Victorina Fischenich. She has an interesting last name. My last name is bigger than I thought. It's more complicated. Her last name is more complicated now. But Victorina Fischneck is joining from a Justisburg, Texas, and she is a wound care management specialist. She is certainly well educated in that area. Let me talk about this my new topic that's connected with the wound care a little bit. Is a hidden behind this controversial dress and not anybody wearing here, but emerging a new kind of medicine. But there was a debate between the Kanye West and then Taylor Swift, a scientific debate. You will be surprised what that scientific debate is. So I'm going to present that topic. In the in the 2015, in Scottish island of Colonsay, a mother of the bride wore this dress, okay, wedding dress. So she is a very unassuming dress. It is a very remote island, and then it was published in the local newspaper address, and all the people present in that wedding. But that dress became a global sensation. I tell you why. That is a global sensation. Everybody got involved in this debate. The debate is scientific debate kind of thing. So the dress that what they're talking about is, so Taylor Swift, for example, she said that is a gold and white. The dress is clearly gold and white color dress. The Kanye West says that, oh hell no, that is a definitely blue and black. That's what he said. The both of them are seeing the same dress. They're telling us two different colors on all of them. The another intellectual joined the discussion, Kim Kardashian. She said that one of them must be wrong. She said that probably but I'll tell you some surprising thing. She's wrong too. so so this is you need a really Einstein's help for this kind of a debate. So I'm going to bring the Einstein to the picture because that is a complicated debate. In fact, it's a scientific debate. A lot of politicians involved. A lot of senators also made a comment that he said that a gold and white. Some people said that, oh, that's a blue and black, and that's crystal clear. But it is a big debate. It created a sensation in the 2015. But I'm going to tell you, this is something to do with the bending of light. I show you how the connection works, something like that, connected with it. Einstein created a bending of light. He gave a mathematical equations of the bending light. So it is, for example, he says that space time, the way because the Earth moves around the sun, because of that bending, the bending curves of the space time, space itself bends because of the mass. So the best example is a trampoline. So the guys, the if they go higher, it goes the dip lower. The trampoline goes lower, it goes lower, it just go they go higher. It's a symbiotic relationship between the trampoline and the kids. They go up and down because that symbiotic. They go down. They curved. Once they fall into the trampoline, it curves. Right? It is a flat otherwise. When they fall into it curves, and then they pushes back, and then they go up, and they come back with a force. They curve back again. This is more you curve it, more they go up. It more curved it is, more they go up. Same kind of a relationship is there in the physics, in the black hole physics. Actually, he doesn't know that they exist, but he doesn't know they really exist. The Albert Einstein didn't know, but he gave the equations for that. So John Wheeler, another physicist, said that Matter tells space how to curve, and curved space tells matter how to move. So that's why our Earth moves. What it does is sun makes a big dent, and then Earth makes a small dent. That the dent it moves around. That's what it does. It moves around the dent. So if we think that that is a gravity, it is not a actually space time bending. So the mass bends the space time. It's like a sari. If you take a big cloth and if you put a big ball, that what the not golf ball. What is that called? Yeah, bowling ball, bowling ball. You put it there, it bends, right? The cloth goes down. That is called space. If you think this cloth is a space time, the bending is space time curvature. The curvature tells how it moves, and then so that's why this bending, the earth moves around the sun. So in the black hole, that is an extreme. Suppose if you have a 400-pound kid up there and he goes on the trampoline, what he does, the trampoline closes completely. It goes completely closed. That is what it does in the black hole. That's right side what you see, the black hole. So black hole is so strong there, the mass is, it bends the entire space time. So it all the light goes around, it follows the space time. It looks like a straight light doesn't go straight line there, they go circles around even to horizon, near the black hole. So if you stand in that black hole and that in that circle, and what you see back of your head. That's the only place you can see back of your head without a mirror. So this is an amazing, the black hole equations. That's a bending of light is an extreme situation. Is a black hole. But in the nature you don't find, you cannot bend the light that easy. You don't bend it. There's no material that can bend the light like that except that gravity and the black hole. But but we have a very powerful people now. So in the future, I can tell you, physicians can order bending light as a diagnostic test. I tell you how you can do that. We bought the black hole bending light, bending the black hole physics to the physician's office is an amazing in that sense. So I tell you in a second. But so actually, it starts with a history. I want to tell you, the mastering the sound and light waves are very important in the medicine and everywhere in the physics and mathematics and every engineering. Joseph Fourier is a French mathematician. He gave us in 1768. He was born, and he gave one of the revolutionized the engineering. Without him, we would not have these devices, medical devices. Would not have no engineering at all. He is the Bible of. He created a Bible of engineering. Is the Joseph Fourier. He gave a mathematical framework for the entire engineering work. So he is the Bible of engineering. In my view, his work is a Bible of engineering. Everybody follows his work, his mathematics. The another one is unknown physicist, unknown physicist from India. His name is Jagadish Chandra Bose. He was kind of he was talking about in the beginning days when I was a kid. I learned about so how the plants can feel the pain. Plants can talk each other. Now we are proving they do that in the fungi and all those things. But he was talking about so there is some connection between. I want to tell you what the connection is. So these two important guys made important contributions in the mastering the sound and light waves. So if you go to a ball game, you can hear that announcer, you can hear clearly well, you know, behind the huge noise behind it. How can you do that? If you amplify, you're amplifying both noise of announcer and the noise of the spectators also. So there is a big problem. There is no other way other than using Fourier transformation, the 17th century mathematician, 18th century mathematician, that just Fourier mathematics, it filters out a particular frequencies and emphasizes particular frequencies. You can hear both. You can manipulate that sound waves. You can control the sound waves through his mathematics, his device. He created that mathematical framework, created Joseph Fourier. So that's why, thanks. We don't know when she's talking in the ball game. We owe a big gratitude to this extraordinary scientist Joseph Fourier. Every engineer knows about him. Every engineer by heart they know about him. I promise you. Now, So the second one is Jagadish Chandra Bose. What he did was, oh yeah, let me, yeah, this is a polarizing light. So what he found out is you can the light is basically electromagnetic wave. It has electricity and magnetism dancing back and forth. That's wave, basically electric and magnetic wave, electromagnetic wave. Light is electromagnetic wave. All the radiation is electromagnetic spectrum. So what he did was, I wanted to only certain kind of electricity, certain phase of electricity he wanted to pass through polarizing light. So he wanted to polarizing light. That's why if you use the Ray-Ban glasses that you see in the sun time, it cools down. You cannot, you don't see a lot of sun. The reason is it polarizes and filters out a lot of light. That's why you can see the same thing happens in the 3D movies when you go to this is a polar. He is the first one who genesis for that, and he used a jute fiber. You see, you go to the Whole Foods store, they give a fiber bags. A jute fiber, that's a jute plant. The jute fiber, he able to use it, send the partial light in the 1800. So he is the first genesis for this kind of a polarizing light. That he was important contribution he made. Jagadish Chandra Bose, his name is a very well known. In India, everybody reads about him. So the next one is the next revolution came in 2000. It was all good. We all did we watch ball games and we watch medical devices. Everything is extraordinary. But in 2000, there was an extraordinary thing happened in the critical scientific discovery happened in Duke University. On the left side, you see this when you see a straw in a water, you see that when you're drinking water in the straw, you see that it bends because the light travels slower in the water, so it has to be adjusted for that speed, shortest distance, and it looks like the straw was not bending. The light that you see, the light is bending to you to show that it bends like that in the straw. Then we are all familiar with it, but you never seen on the right hand side one. It doesn't bend other way around. Dr. David Ross Smith, a distinguished professor of electrical engineering and computer science, created a material that bends other way. It just opened up, and it's called a negative refraction. It opened up entire field, the world of different materials. It's a man-made material. You cannot do that easy. That refraction, you see this way, and the other way around is extraordinarily difficult. And he did that. He achieved that. That is the greatest discovery in the 2000. It is That's a birth of a metamaterials. Metamaterials are artificial materials, engineered. They're engineered materials to have a properties and a characteristics that are not found in the naturally occurring materials. You don't find them, this kind of a materials. He created a alloy material, he created, he manufactured, and then you put that thing. How does that work? Metamaterials are based on Japanese thought origami. The way origami they do that is that they create these metamaterials through twist and turns. So they can twist the light, twist the sound. They can do anything you want to do with these metamaterials, with the twisting the sound and light and sound with the metamaterials. So you can create like origami structures with the metals, then create metal surfaces. You can play with the light and sound the way you like it. That's an extraordinary achievement in the metamaterials. That's the birth of, they call metamaterials. They don't find in the nature. You have to create it. We are a tribute to the human genuinity that is ingenious. We have is tribute to human discovery. So, so metamaterials are science fiction to come to reality. That's a metamaterials. So that Star Trek movie, you see that Dr. McCoy, it is use a tricorder that is basically come to reality now with the metamaterials. Very surprising. So metamaterials are very strange. So if you are walking in front of them, you can basically bend the light enough with the metamaterials, you cannot see him. He disappears. Bending light waves, you can bend the light waves around him, and then if you see him, you don't know that he exists or not. So It is the metamaterials is invisible man comes out of the picture. That is that is that is a that is, for example, is actually you can see it. That person is there. There's a real picture in the middle. He disappeared. If you see him, only his head comes out. You cannot see the rest of the body, even if he's standing up, because you see the entire field. Invisible Man, you saw the movie in the 1970s or 80s. So if you're old enough, that's a very popular movie. Then Kevin Bacon did the latest movie. I used to be watching that movie all the times. Then if you see the hand on the left side, it passes through. You don't see the hand anymore. Metamaterials allow you disappearing. It disappears a disappearing man and disappearing anything that you put in front of them. So that is a very strange metamaterial subject. So there is a Mikhail Fedorov, Ukrainian Minister of Healthcare, Information Digital Transformations, is a very unknown outside, but he's very popular in Ukraine. This guy recently, last 2 months ago, that he gave a showcase that you created a blanket, invisible blanket. You just throw on the soldiers. While they found out when the Russians were killing a lot of Ukrainian soldiers were hurt, and the drones come back and kill them more. So when they get hurt, so they see them. So what he was trying to do is throw this blanket on the soldiers, so they become invisible. The drones cannot find them. So that's one of the. So he became a deputy prime minister. He was promoted as a. So it's a new war arsenal was created. You're going to get a invisible soldier soon. You don't see them next to you, and they shoot you. That's a very scary, but it's a bad thing. But you can also do good things with this. Always healthcare comes out of the defense. Defense. All the inventions come from the defense industry. A lot of healthcare inventions. So metamaterials for health is just blown up. It's a very new. It's less than 20 years old, but it is growing unbelievable amounts. AF devices are coming into the metamaterial devices for healthcare. I'm going to talk about a couple of them quick. So breast cancer detection traditionally, a lot of women go to the mammograms. I used to own an imaging center. Mammograms are just very old, big machines, and then it's also painful for a woman, and they have to go through a lot of process and very expensive. And it's a long line, long queues, and the access is a big problem. It's a big machine. Quality is also the miss and hit. It's a big problem with the quality of the mammograms. So it is a radiologist challenge, that is. So the breast cancer screening is a traditionally that is what it is, and a lot of poor countries like Africa, India, and poor rural villages don't have access to mammograms. So already too late by the time they get the screening. So if in the future of the metamaterial, if you use a metamaterial in the future, it's just a small box. You can go to drugstore and rent it for a day, for half a day. It is just so small. You can put a breast inside, and then you can tell it. It tells you right there. It is if there is a cancer there or not. It is an amazing invention. They use the radio waves. They don't use X-rays. Mammogram uses X-rays, but this uses radio imaging. Very affordable, portable. You just carry it with the hand, and best quality you can find. It is because of the radio waves, the way it does work is an extraordinary quality. You get a better diagnosis than any other metamaterials produce. This kind of they can condense the weight of all these diagnostic equipment. If you see an EMRI, for example, Victorina is talking about she did MRIs, CT scans. MRIs are big ass machines. That's all. The gantry, it makes noise. It's huge. You need I used to sell MRI machines. You need to have cranes to pick up that magnet. It's that
Mhm.
big. So it's very expensive. How can they afford in a small third world countries or developing countries and small villages, poor rural places? There is no access to MRIs, so it is really difficult for them to do. It's a very costly, big, and okay quality. The quality may be better, but access is the biggest problem with MRIs. So if you use that, magic happens with the metamaterials. You need a fan, small fan size MRI. You can do that within seconds. You can lay down and put that there is a I didn't put that one actually, a small blanket. You put a blanket around the knee and they take a picture. Done deal. It comes with a radio imaging with a 1.5 Tesla that can come with the same quality as that one. This small fan can do that. It's the metamaterials can the new science fiction is a portable and the best quality comes out. The next one, it is ultrasound. Metamaterial ultrasounds are coming up. Is actually biggest challenge is pancreatic cancer is one of the biggest challenges among the cancers. And Steve Jobs died here, right here in Silicon Valley. So the one of the problem is a challenging problem with the pancreatic cancer, pancreatic pancreas is the penetration of the pass through all those things and the walls. So this ultrasound made from the metamaterials can penetrate that, can make it easier. You can see walls and crystal clear. You can see the fluid and walls and everything in the size. It can create penetrating bones. It's an amazing metamaterials can do magic. Then you see metamaterials is the terahertz imaging is coming up. Clear, if you wanted to do surgeries, for example, clear that you can tell clearly tumor dead and healthy cells. They separate the dead and healthy cells, separate it out. Metamaterials can do an excellent job in this kind of imaging. It's new kind of imaging, radio imaging, terahertz imaging is coming up. It's an amazing surgical instrument that won't vibrate. The metamaterials you made from the surgical instruments, they won't vibrate. Think about this, guys. What we are entering into the new world of medicine. Stroke detection. While they're coming from an ambulance, if you put that hat made from a metamaterials, it will recognize what's going on with the patient in seconds. So it is just and then surgeries, for example. I was talking to Diana Landonio. She's a urologist. She uses a lot of these um, uh, these uh, catheters and stents. So that's one of the things. Is a lot of these are all they're all they are degrade in over the time. Degradation is a big problem, but with the 3D printing with the metamaterials, they can stay a longer time. If they get printed out in the metamaterials, they stay a long time. It's an amazing discovery of the human beings, in my view. Stents and catheters for the cardiology. You can do cardiology, urology, everybody uses stents and catheters. There is no, so it is a very, probably in the future, they're going to create a mesh with the metamaterials for the wound care also. So bloodless glucose, I'm going to show you how the bloodless glucose, the changes. Just give me 1 second. I'm going to you how the bloodless glucose, how that, I'm going to play that video 1 second. So there are a lot of companies are doing that metamaterials. Basically, what they do is glass fabrication factories. They convert is a kind of a hybrid model between the integrated circuit fabrications and glass fabrications. It's kind of hybrid model. It has to be very clean and cut. You can make all of the metamaterials there. So there's a lot of medical companies they're doing in the metamaterials. TerraView is one of them. Meta is not the Facebook, is a different company. Meta Beyond, Go Beyond is a different company. Multi-wave imaging. There are several other companies are in the field right now. These are TerraView, Meta Go Beyond, Multi-wave imaging, and several companies are in the picture right now. So it is aliens, for example. That's I wanted to add this. It is a yeah, they in somebody this at least in the Scientific American published a article, whether it's true or not we don't know yet. It's aliens, all the alien technology, UFOs. They came. You're using a metamaterials. They found the metamaterials that they're using, and then is in they're stored in the Las Vegas building. We don't know yet, but it's at least it is an interesting note. Okay, so metamaterials are it is so I coming back to the dress actually. So metamaterials are useful. It's not that connected to the metamaterials in these dresses, but this dress, but it is something to do with the bending of light, and the brain and mind is a very more complex than what you think about. This is not an optical illusion. Optical illusion is just you cannot find that one, and both of them interpret, they can't see they see the same thing, but they cannot see otherwise. This is different. Is a brain and mind, or this is one of the areas. Brain and mind may be coming back. Is the two different things of the problem. There may be consciousness. There is something, because our brain is processing is different for each one of them. They are all real. It's actually that's what they see. They're both are true. It is not nothing more. So the scientific debate is just that itself is true. Both of them are true. So we don't know what color. That is a interpretation of the brain. Interpretation is coming out of the brain, outside of the brain. We don't know. It's a mind is another way area that is coming out. It's a very interesting topic. We don't know the answer yet. We don't have the full understanding of this process. Why they see two different the same gown, people see two different colors and two different things. It's absolutely fascinating. Thank you for watching. It is an honor to we need to contribute to this. All these we need to pay attention to. All these we tributes to these great scientists who paved the way for this kind of humans to go to the next era of new science and medicine. Albert Einstein, Joseph Fourier, Jagdish Chandra Bose, and then Mona Hawley, she works for the U.S. Navy, and Tom Andrews is one of the first ones who designed this metamaterial packages. Thank you all for joining. It is thank you for joining. We need to be. Let me bring um, Victorina back to the stage. What do you think, Victorina?
Ah, that's interesting. The metamaterials. Man, what application would that fall into for wound care? That's
That is fascinating, right?
Yeah,
So
it is. It really is. That's the first I've ever seen.
yeah, actually, they said that it works for the wounds because it taps the heat there. It can tap the heat and it just stay there. They could use it for the future for the wound care in that sense. It is a very new. I don't know any there are some companies are working for this wound care area. I don't know the
Mhm,
exact. I can tell you they are working with the arthritis patients, for example,
mhm.
arthritis that heat that can create their wound care. Also, there are. I'm pretty sure there are some people are working on it in the research side. It's going to.
Yeah, like applications for neuropathy or applications for biomarkers in the wound.
Oh yeah. So
Mhm.
it is a fascinating in the materials coming up. But you're in the present moment. You are doing all the work. You're educating doctors and everybody nurses around the country. And then you went to India also, right? You visited
Yes,
India and other countries
yes.
to educate and talk about the wound care, right?
Yep, I spent time in the Apollo Health Systems, really nice hospital systems in India. Very nice.
Okay, very good. So tell us what you're doing now. What is your present
Well,
doing?
I'm consulting for a lot of startup companies. So just trying to find them their right niche, their right networking, their right key opinion leaders, research sites for them. And so I'm working with Scandinavian Med Partners. They're also associated with the Asia Med Partners. So that's kind of what I'm doing. I'm helping consulting for that. I'm also working for MedQ, the copper dressing, and a lot of startups. So some I can't even mention yet because they're not completely launched. So
Your
very
Gmail,
good.
your account is vnfgnp@gmail.com, right?
Yes, yes.
So Thank you. Totally fun to talk with you, Vicky. It is a wonderful, a lot of education for me. I don't I have zero background in the wound care. I learned from you quite a bit. Thank you so much. I've
Well,
been
thank
following
you. I
you for
learned
a
quite a
while.
bit from you too.
It is an honor and a privilege for me to talk with you.
Okay.
Thank you
You have a
so
good
much.
evening.
And I'm going to play some quick video, and then we are going to say bye to good night, all of you guys joining me. Thank you for joining. And I'm going to just let me do that, and then thank you.
We are retelling their stories through our patented designs that can be worn on scrubs, t-shirts, printed on conference bags, and endless other promotional materials. Daily Wear for Medicine is the first ever of its kind to create curiosity in medicine through visual art. We at MedBricks are celebrating unsung heroes of the past who made enormous contributions to the field of medicine through our unique campaign called Daily Wear for Medicine. You can wear it, carry it, and give it.